with your feet wide, push your heels outward. And as you push your heels outward, you'll start to feel your outer hips engaged. So that will actually intensify the stretch a little bit because you're going to feel that your pelvis tips more as a result. One of your abductors is your TFL, tensor fascia lata. So keep pushing the legs apart and start to rotate your thighs in slightly, like turn your upper thigh bones toward each other a little bit as you push out, and you'll feel TFL, tensor fascia lata, engaged. So I usually say push heels apart, so your TFL, tensor fascia lata, activates when you internally rotate and try to abduct. And TFL is not only an internal rotator and an abductor, but it's also a hip flexor, which tips the pelvis forward more. So that's a hip flexor. It brings you deeper into hip flexion. Something I want to talk about is reciprocal inhibition. Reciprocal inhibition is activating the muscles that oppose the muscles that are stretching, meaning the muscles that actually create the shape. So when you walk and you step let's say your right foot forward, your hip flexors and your quads activate. As a result, the body releases buttocks and hamstrings. Hopefully that's the process that we have if we have a healthy movement pattern. Okay, so again, you're walking, your right foot steps forward, your hip flexors and then your quadriceps activate. And as a result of reciprocal inhibition, that's what we call it, your buttocks and hamstrings release tension in order for the movement to occur. Now, activating the quadriceps would help with reciprocal inhibition because one of the quadriceps is your rectus femoris, which is also a hip flexor. So you would activate quads by lifting your kneecaps up and trying to think about pulling pants on, but suction cupping your thigh bones up into the hip socket. And then what that will do, that kind of sucking the thigh bone up into the hip socket, it'll turn on your hip flexors and your quads. Again, that's going to help the TFL in reciprocal inhibition.